and we are thrilled today to have Claire Biribawa and Dr. Vicki Simpson. Claire is our inaugural Valerie Møller Fellow. She is a PhD candidate at Macquarie University and Ghent University. As I said, she is the 2024 Valerie Møller Fellow, a public health specialist pursuing a joint PhD at both Macquarie and Ghent. She has led impactful research on substance use and quality of life in sub-Saharan Africa, including establishing Kampala's first alcohol and drug abuse surveillance system. Her mentor, Dr. Vicki Simpson, was the associate professor of nursing at Purdue University. She is emeritus professor now. She was the head of academic affairs and associate professor, as I said, Purdue University School of Nursing in Lafayette, Indiana. Her career focused on improving quality of life through building collaborative community networks that enhance access to resource, resilience and well-being, and she's contributed to ISQOLS for many years through research on community resilience, international mentorship, and fostering interdisciplinary approaches to quality of life studies. So just to give a little brief information about our fellowship, it was established back in 2024 by our then president, Dr. Martijn Berger. It was originally called the Developing Country Fellowship, but we changed it in honor of Valerie Møller, who is a pioneer in quality of life research, especially in sub-Saharan Africa. It supports a researcher from a developing country who is working quality of life, happiness, or well-being studies. And the fellowship includes full membership, full conference support, a mentorship pairing, and research dissemination requirement. So Claire, can you speak a little bit about your academic and professional journey, how you came to focus on quality of life?
And so in this field of public health focuses on, creating conditions that help entire populations stay healthy. And we work to prevent disease, promote well-being, and ultimately improve people's quality of life. So public health and quality of life are quite intertwined. And with public health, we put in place various interventions that are meant to reduce disease pattern, but then ultimately make life better. And we need to see whether it's actually doing that. And so studying quality of life as one of the outcome is very important. For my PhD, we're studying treatment outcomes for patients with substance use disorders, and substance abuse is really a growing problem in sub-Saharan Africa and also Uganda. Many people are struggling with addiction and they want to improve their lives. And for many of them, actually, poor quality of life drove them to start abusing substances. So my work looked at how treatment and recovery services could be evaluated, not just through the clinical outcome lens, but then also looking at the overall improvement in people's well-being and life satisfaction. So that's how I came to focus on quality of life research, even as an epidemiologist.
And I mean, as you were speaking, a lot of similarities to Dr. Vicki Simpson's background and your research. Vicki, if you would mind giving a little bit of a background about how you connect with Claire's research.
Sure. So it aligns perfectly with both what I've done as a clinical nurse and what I've done as a nurse researcher. So early in my career, I spent a couple of years working in mental health settings and providing home care, as well as working in homeless shelters and several other community-based entities. And so I focused a lot on substance abuse treatment and helping to develop strategies to ensure that people get the treatment they need in maybe a hospital setting, but then once they go out, that the structure is in place to help them be successful and to sustain recovery. So I did that a lot early on in my clinical career, but then when I became a nurse researcher and started really focusing on community resilience, I once again reverted back to that because substance abuse is such a problem in the US as it is around the world. And despite some differences in what occurs in Africa versus what occurs here in the US, there are many similarities in a lot of ways to the problems that we see that really keep people from being able to recover. And my research really has demonstrated strongly that need for communities to be resilient and for communities to be able to support the recovery.
So such a great connection between the two of you, and that really blossomed into the presentation that you both gave at the ISQOLS 2025 conference. The title of your presentation was Treatment Experiences, Challenges, and Quality of Life Improvements Among Individuals with Substance Use Disorders in Uganda, a Qualitative Exploration. Can you describe that briefly for us and tell us a little bit about how the presentation went and what the outcomes were?
So my presentation shared findings from a study that explored how people receiving treatment for substance use disorders and healthcare workers who support them experience the whole treatment process. So this was a qualitative study that integrated the perspectives of both the healthcare workers and the patients into one single analytic frame, and we needed to map out the full treatment trajectory right from admission through to community re-entry and identify any barriers and facilitators that shape treatment and recovery outcomes. That way we could know what really hinders treatment and how current systems could be improved to better meet people's needs and improve their overall quality of life. So there are mainly three things, or I should say there are four themes that came out. First was really highlighting how the system is, and the system, should I say, was running on empty. Health system is grappling with staff shortages, essential medicine stockouts, and several other infrastructure challenges. And so most of the time, the healthcare workers provided care that was fragmented and focused on relieving symptoms rather than long-term recovery. So secondly, they ended up sending the patients back when they are not resilient enough to get back to an unsupportive social environment, and that increased the likelihood of relapse. So many patients would relapse because the broader social and economic factors that shape recovery and quality of life, such as stigma, poverty, family strain, even poor mental health, were not being addressed. So relapse was inevitable. So it's more like a reinforcing cycle. Where patients relapse, they go back to a system and they overload it again, and then they're still sent back when they're not ready, and then they end up coming back. But they're able to suggest some recommendations that could help sustain recovery. And the main thing is that for recovery to be sustained, investments should go beyond the hospital to community-based recovery support and quality of life improvements, because it's such situations that force them, for many of them, such situations that force them to start abusing drugs, so they need to be addressed. And we hope that those help shape the current policies as they reintegrate to create lasting recovery solutions.
So interesting. Dr. Simpson, what stood out to you with this research project, and how were you able to contribute as a mentor?
So Claire and her team had already collected data, or they were finishing collecting it. I don't remember exactly if it was totally completed, but so they already had this very rich data set talking to both recipients of care and people to help provide the care. And they had done a fantastic job of ensuring that they had representation from various types of providers, as well as various types of people who had received care. So she already had this wonderful data set. And so my role really was to collaborate with Claire to design a rigorous system to do thematic analysis of the data. So Claire and I worked together to develop that process, informed by Ronan Clark. And we then spent several weeks going through the data, both independently, coming together to discuss it, going back again until we got to the point where we were able to determine the themes that Claire just identified. So it was truly fantastic to be able to do that. It built upon my experiences in the past with qualitative data analysis. So it actually was very enjoyable for me to see the data that they had collected and to really help through this process tell the story about what's going on there related to substance abuse treatment recovery.
Amazing. And so what's next for both of you on this project? I assume it doesn't end here. You presented at ISQOLS 2025. What's the next step?
We're writing a manuscript out of it, and hopefully it will be submitted as soon. But then from that, and then also from what is on ground, we identified that there is a lot of lack of community support. So we were able to write a grant, small grant, really, and it was funded. It's focusing on on community health workers who are able to provide screening, brief interventions, and then also be able to provide some relapse prevention for the substance use disorder patients.
Any advice for someone who takes on this role as a mentor for a Valerie Møller Fellow or any other student within ISQOLS?
As a mentor, you also have to be confident in what you know and what you can do. Because there were things I would suggest to Claire and she would say, oh, I wasn't familiar with this, and things that we might do here in the States that could be used in the context of Uganda. And so all of those things I think have been very helpful to keeping our relationship going. And, like I said, just that constant communication.
Well, it sounds like this is just the start of a long, hopefully long partnership and a long relationship, which is fantastic.
I think it was a great experience, and more so when you have a mentor like Professor Vicki. I should say that her patience and then also the generosity of sharing her knowledge really taught me grace. She taught me how to mentor someone with understanding, without judgment, and then also allowing them room to grow. And that is something that I will take on, and I hope I can be able to mentor and collaborate with some other people that I will along the way that will come my way in the way that she did it so gracefully.
Well, thank you, Claire, for those kind words. Thank you. And as I said, Claire herself is just a phenomenal student, and I think probably one of the more important pieces too, though, is that alignment with the research in some way, because it did allow us really to expand on what Claire was doing, I think, and make it much richer. So she would have gotten there on her own, but
I'm sure you contributed greatly to that success, but thank you both for being here, for sharing your story, for sharing your experience in the Valerie Møller Fellowship. Please keep us updated. Come back, present your research if possible. We would love to share that entire community. So thank you again for being here, and best wishes in your future collaboration.